Hello, I'm Eric Bowen. I'm one of the staff cardiologists at National Park Medical Center. Stress testing is performed to determine if a patient may have issues with their coronary circulation. Sometimes patients who've already had stents or bypass surgery will have stress tests for surveillance to make sure that everything in their circulation is performing properly. But a lot of the tests that we perform are for patients who have new onset of symptoms, such as shortness of breath, chest discomfort, or they may have multiple risk factors for heart problems such as hypertension, diabetes, or a strong family history. So a lot of times this is one of the first line tests that we do to determine if a person truly has cardiac issues or not. So it's important to realize that this is not as diagnostic as the arteriogram, but it gives us suggestions if there are problems or not. Stress tests are typically performed in the hospital under the supervision of our nuclear technologist. These tests typically take about 2 to 3 hours. Some patients walk on the treadmill, some do not walk on the treadmill for various reasons, and these are the folks that we typically do a nuclear stress test on. Typically, a nuclear stress test will have two portions. There's a resting portion where the nuclear camera takes images of the heart muscle at rest. Then within 1 or 2 hours, the patient will either walk on the treadmill or possibly injected with a medication to improve their heart rate. Then the images are then repeated to see if there's a change in the circulation patterns from the resting images to the stress images. Most of the times patients will fast before the stress test, but you can resume normal activities after the stress test. It does not require any sedation, so there's no issues with a patient driving themselves to or after the test.